Are you a physical therapist in a cash-pay setting and you're concerned about burnout? Or you worked in a traditional mill-like ortho setting and you want to come over to a cash-pay setting because of burnout? Let me share with you that cash PT burnout exists and it will happen to you if you don't do these things. My name is Garcia. I help cash-based physical therapists just like yourself thrive in business, improve clinical outcomes, and become that go-to expert in your community. This cash PT burnout concept, it exists. I've been practicing for 10 years as a cash PT. I have 3 locations. I've been able to grow to over 15 staff. And I opened my practice 10 years ago to offer something different, probably like you, to be able to help your local community do something different and not be like those large mills that you didn't want to work for but had to. And you probably in that 3 to 5 year mark started wondering if this is the setting for me. Maybe I don't like ortho. Maybe I should try peds. Maybe we should try in hospital. And you realized that no matter where you were going to go, it was going to be high volume and you were going to be burnt out anyways. You're not having time for documentation, seeing 30 people a day, or, just the mountain of documentation that was necessary. And you wanted to make that leap to a cash-based setting, or you're considering that. And I will tell you that cash PT burnout exists as well. And here's why it happens. And it usually happens within that 2 to 3 year mark of trying cash PT. Here's a couple scenarios. You have an insurance-based provider who comes over and they try cash, and they might be working a couple side hustles. Maybe they work a little bit of mobile therapy. They work in a hospital. They work neuro on the weekends or nights, whatever it is, to help offset how to improve and really get to the point that they want to. And here's the problem. They eventually realize to a point that, maybe at first you get this surge of new customers and you go on Instagram, you go on social media and you announce, I'm now offering one-on-one personalized doctor physical therapy sessions in a cash-based setting. Who wants to come with me? And you get an initial surge. Yeah, I'll support you. And you get all that going on. And eventually that kind of dries up. And that's probably within the 4 to 6 month mark. And now you don't have any more new patients coming in. So maybe you start doing more community outreach events and you start going and doing these things. And you're kind of stuck because you work on weekends and those are the times where you'd be networking or meeting new cash patients, and you don't want to give up, income or revenue that you would be normally getting with a normal paycheck. And so you have this balance of, well, how do I get more new cash pay patients? And you have this kind of side hustle time. And ultimately you're trying to figure out, is this for you? And you start questioning after a while. I'm not getting the cash pay patients. I'm getting people better. And that's in 2 to 3, maybe 4 visits. And now they're leaving you. And you really don't have any structure. You've used everything from an insurance-based setting. You've brought it over to cash and it worked for a couple customers, that initial surge. And then you get people better for 3 to 4 visits. And you're like, well, gosh, how do I get the volume of patients that I need to be able to be sustainable and maybe let go of the side hustle? Or maybe you're all in and you've done this and you're stuck and you're concerned that your numbers aren't looking as good as they can be. And I'm here to tell you, cash-based physical therapists will burn out because they just rely on that insurance-based model or that PT school model to come into cash. And because it's personalized one-on-one, you went from structure and diagnoses and impairments in an insurance-based model to freedom in a cash-pay model. And you're like, well, I'm not comfortable with freedom, so I'm just going to use the same foundation that I used in insurance and I'll bring it over to freedom. And they're 2 different scenarios. And when physical therapists use the same approach, they start working and they start treating patients. But when you get that initial surge and everyone leaves, and now you're only getting 1 or 2 new patients a week, and you can only do so much on community outreach events, you now start to figure out, wow, this is not working at the rate that I wanted. Well, maybe it's my town. Maybe it's my prices. Maybe I should need to give a sale out, or maybe I just need to try a new marketing event. I need to try something new. And then you get this wheel of a high surge of new patients. They drop off. High surge, drop off. And you start wondering, like, how is this sustainable? And so you start working more hours, but that doesn't always equate to new patients. So now you're getting creative with your sales process, your marketing process. New patients are showing up but not at the rate that you're actually working. So you actually start working more hours for less patients. And so that's the reason you got out of insurance-based care, because you were working more hours and not getting the benefit out of it. So now you hit this burnout phase where you're trying so hard to work more hours and hoping that it results into more patients or more revenue or more profit. And so you have this working hours starting to increase and the number of patients is not equaling that. So you have this huge gap, and that's where the burnout works, because you're just working so much and getting so little in return. And the real reason and the honest reason how to conquer that, how to avoid that is the 3 Ps in business. There's people, product, and the process. And physical therapists are so concerned about the product. I need to learn how to mobilize. I need to learn how to tape. I need to learn how to do strength and conditioning. That's the product. You're getting better at those things. But the two other sides to that is the people. Like, we don't really typically focus on what's different about this customer than this customer. It's not that they have a different knee or region that's in pain. It has nothing to do with that. It's their decision making. It's their expectations. It's their personality, understanding the person. But most importantly is the process and how you take a person, a cash pay patient, from an initial evaluation to follow-up sessions, to plans of care, into strength and conditioning, into wellness, and help them across their health continuum. And the problem that becomes is PTs out of insurance-based care into cash PT, they just focus on pain, they get that person better, and it's just this steady wheel. And the average visit rate is probably around 2 or 3 visits. And while you might think, gosh, that's fantastic, that person wants more, they need more, and they want to be able to get back to fitness. You just got them over pain. They want to get back to exercise. They want to work on the mechanics. They want to work on their strength. They know that, but you know it's beneficial, but you don't know how to offer it. There's no process. And because you try to open a fluffy, one-on-one personalized physical therapy clinic, you made it so tailored that everyone got everything so different, and you had to tailor and create a new program for every single person that was 6 weeks long, 8 weeks long, that no one actually did your program. It was too personalized and overwhelming. And so you went from prison, insurance-based care, to freedom, and now you went too far. And what happens is, in that prison mode and insurance-based care, structure is great. Now you can still take a portion of that structure and create your own process. But because you went into freedom, you had no structure, no process. You treated everyone so fluffy, and you just wanted to personalize everything. And that was the problem. When you try and do that, that's so much work. Inside is a more efficient way to do that. And one of the things you need to do is structure your initial evaluations to be exactly the same. Now you can still tailor it within that session. Your follow-up sessions need to be exactly the same, no matter if it's a back, a shoulder, a knee, or hip. That is how things work. And you need to create a checklist of exactly how your process would look like if you had a back pain patient or a shoulder pain patient. And the problem is, you've never taken the time to prepare. You've always relied on, well, I'll just wait till it comes in. It's a shoulder, it's a back. Let me see what it comes in. Let me just see it. Let me just feel it. And you know that healing is healing. It's very predictable. You know people are going to get better in a certain amount of time, whether it's a back, a shoulder, a knee, a neck. It doesn't matter. And that process is the biggest thing to help you overcome that cash PT burnout. So instead of trying more personalized one-on-one care, simplify it and create a streamlined system to help you day in, day out be more successful.